Hello. For this first podcast of 2016, I'd like to begin by paying tribute to staff who have worked all the way through the festive period and in particularly have played a remarkable role in helping people during the recent severe weather. I don't think anyone could have predicted the very severe weather we've had over recent days, and I think it's a real tribute to staff who have helped out in terms of protecting vulnerable patients, helping people evacuate from homes and making sure that health services were resilient right the way throughout the period. So I think right the way throughout the festive period and also the recent severe flooding, particularly when some staff had their own homes at risk, thank you very much indeed for all of the work that's been undertaken. And I think the way in which we in the health service have worked with partners in police and fire and rescue and local authorities has really been a tribute to our public services here in Grampian. I'd also like to thank staff who have worked over the festive period in particular as well. The service has been busy, but I think we've seen a level of resilience that we haven't seen in recent years, and thank you once again for making sure that patients could be seen in a timely and effective manner and treated in the right place at the right time. Thanks for everyone who worked over the festive period. The board of NHS Grampian and the senior leadership team think that we need to get a strategy in place for safe services, effective services, person-centred services and sustainable services for the years moving forward. We've been looking very closely and participating in planning that's gone on at a national level, at a regional level across the 5 different health boards, and we're looking to develop a clinical strategy for the NHS in Grampian for the coming years. The strategy is going to set out Grampian's main priorities for the future, set out a clear direction of travel and a framework in which we can make changes to services to make sure that those services are not only provided in a high quality, safe and effective manner, but also as close to home as we can possibly manage. The strategy will be a 3-year rolling plan with some very specific outcomes and objectives for each individual year. It's really important that all staff have got the opportunity to contribute to the work on the strategy. We've already held a number of workshops across the region and we seek to publish a draft strategy during the month of February, and we are going to make efforts to make sure that staff have an opportunity to contribute to that, and then once it's approved by the NHS board, an opportunity to mould and shape local strategies, local plans that will fit in with that wider strategy. As I reflect on my first year here in Grampian, I think we've taken some very significant strides forward since I started in December of 2014. I think we've seen developments over a whole range of fronts, and it's been particularly pleasing to see that we've managed to get some additional staff of 300 right the way across the region. We're having better outcomes in terms of filling some of our consultant vacancies, our nursing vacancies, and return to practice courses, a whole range of things I think we're seeing real progress in. And again, I want to thank staff across the region for some of these real improvements that we've seen. I think central to that progress is caring and listening and improving and putting the values of NHS Grampian at the heart of what we want to do. We want to make sure that we work in partnership with patients and with their families, that we work in partnership with local communities, we work in partnership with local authorities, the police service, voluntary sector organisations, and that we work in partnership with our local universities and College of Further Education. We want to make sure that we work in partnership with our staff, and our staff governance and partnership arrangements I think are strong, and we're seeking to reinforce those. And we're seeking to work too in partnership with all of our professional staff through the professional advisory structures. So the values of NHS Grampian, not only in what we do but how we do it, upholding the highest standards of behaviour and actions, that we do the right thing for patients in the right way, I think has been central to some of the real achievements that we've seen. And while we're not through winter yet by any manner of means, I think some of the resilience that we've seen in the system and some of the real improvements that we're seeing in patient outcome and patient treatment, I think is a tribute to all of us who work here in NHS Grampian. So really, on behalf of myself and the board of NHS Grampian, I think it's a big vote of thanks to everyone who's helped not only over the last few weeks and some really challenging situations we've had, but really thanks to everyone who's worked together over the last 12 months to see some real changes and some real improvements. I think we've got some momentum going here, and I think we want to keep that momentum going in the new year, and seeing the advent of the integrated joint boards and the new role for NHS Grampian, I think we're very much committed to taking things forward. So a big vote of thanks from me and from the board for all of the work that's going on right the way across the region. Thank you very much indeed.